No need to put your names in the chat. I get an attendance at the end. So thank you for those of you that are here. As far as camera, if you want to be on camera, fine. I'd like for you to be on camera, if you don't mind. And you have to have your Canvas name on your Zoom so that you can get recorded for attendance. So far everything looks good. Tacola, if you could put your last name. Hi. You put your last name in, that'd be great. Why don't you get credit for coming? How's everybody doing for a Friday? I've just seen a whole group of you because we just had class. So thanks for coming back. It's a grind, right?
Yes, ma'am, but it's worth it.
Yeah, 2 hours of class and a review session. So I know for those of you that we just finished up with class, the week 3 concepts will be a review, but for others that maybe had class Monday or Tuesday or Wednesday, we'll keep going through it. Okay, so hi Devion. How are you? Okay, so I'm gonna pull up I'm gonna share a document. Okay, this is what I do. I know the review we send you is blank. It gives you the concepts that are being covered. So hopefully with readings, quiz information, lectures, you have started to fill that out. I have filled it out a little bit in order to help you guys out.
You think you can print something out?
Okay, so these are the things we want to.
All right, can you turn it on for me? You can use the pink paper, I don't care.
Can everybody see this? Yes, no?
Yes.
Okay, so I promise in the future I'll attach this to your exam 2 and 3 study guides. But anyway, this is what I've put together for kind of a cover sheet. Okay, for what the exam looks like. All right, so it covers 1 through 3, including healthy people. There are questions on the exam about healthy people 2030, but we'll go through it. All right, 50 questions, multiple choice, select all that apply, 5 math problems. Okay. And I've put the different kinds of math right here. Okay, math problems. If you have issues with math, couple of suggestions. You have your Calculating with Confidence book in your student resources. Okay. You also have in week 1, all three of the instructors posted math resources. I would suggest, I posted several. There's one in particular, couple in particular that I think are very good. Professor Bogart, her math resource that I sent you, she has a YouTube channel and she does a math tutorial, and it's Basic Math 101. I would suggest you go back to week 1 and find that if you struggle with math. Okay. The second, I believe I sent you I sent you a whole bunch of math resources. Dean Brown did a math one Saturday morning a while back, did a math basic 101 tutorial for students. I've sent you that link. All right. You don't want to get math questions wrong on these exams. These are easy math questions that you have to be able to do. Okay. So the kinds of questions that will be asked is 5. Calculating a single dose, calculating a total dose, calculating by weight, calculating mils per hour. So you need to know your conversions. So it makes me crazy when you guys get math problems wrong, because they're very easy math problems. Not only are they easy, but you need to know how to do these basic math calculations. Okay. So review math handouts, do practice questions that were posted in the announcements. I think I posted a couple of worksheets with math problems, simple math problems. So go back and look at those. Case study applications of concepts. We did a quick case study today. I'll send you the case study with the answers and the rationale so you can review that as well. Okay. NCLEX, you've had a set of NCLEX questions. Again, I can't stress enough. NCLEX questions, review the rationales. Okay, the NCLEX questions you did for week 3 have everything to do with the concepts were covered in weeks 1, 2, and 3. So if you need to go back and review your rationales and for NCLEX. Other good practice is your other classes. We don't have CJ Sims in this class. Okay, but your other classes do. A lot of you taking peds and med surg, I know you have CJ Sims. Okay, CJ Sims are always a good practice. We are recording, right? Good. CJ Sims are always a good practice for the way questions are set up. It really gives you that knowledge to application practice. Okay, I just got finished talking about to my Friday class. You know, these quizzes, exams, HESI, it's all about knowledge to application. You're expected to have the knowledge of these concepts. That's what lecture's all about. But then you need to be able to apply your knowledge to clinical situations. That's why we see a lot of our quiz questions. Well, the quiz questions are clinically focused. You're in a clinic, you see a patient shows up to the outreach clinic, patient shows up to the urgent care with this. So it's clinically focused, taking that knowledge and actually taking care of clients. Okay. Priority questions. We'll talk about this in a minute. Well, we'll talk about it. There's lots of different kinds of questions you need to be aware of. Okay. And I just went through with I think I went through it with every class this week, going through the quizzes. You've got to be able to, I don't know if you use the highlighter or the underliner as tools in ExamSoft, but I suggest you do. Okay. You need to read the question twice. I know nobody reads questions just once. I know that for a fact. I know it. You guys do it twice. I know you do. Because the first time you're taking your highlighter and you're highlighting important words in the question, right? So that when you go back, those words stick out. So who's your population? What's the environment? Is it asking anything specific? Like, what's the first? What's the highest? What's the last? What's the most important? What's the initial? Those kinds of words matter. Okay, and if you're whipping through the question, you might miss those words. Okay, I'm just really kind of just doing some way to take test prep here. And then the second tool is your underliner. So when you're reading through that question the first time, you highlight what's important in the question. And then first of all, look away or don't look at the answer. See if you can come up with an answer in your head of what the answer might be. And then go look at the answers. If the answer's in there, it's probably right. Okay, but let's say you don't do that. That's fine, whatever. I'm suggesting you do that because it gets you to openly think about not being prompted by the answers. Think of one by yourself first. Think of what the answer should be. Then when you get to the underliner, remember, this is your first stab at the question. Cross out what you know is an incorrect answer. All right. So then when you go back and read it a second time, you are going to have words that pop out, like what's the first, what's the initial, right? You're also going to have answers that are crossed out. So you may be choosing from 2 answers instead of 4. The other kinds of questions you need to be careful of the negatively framed questions versus positive. What is somebody give me an example of a negatively framed question. Give me an example. Come on, give me an example.
Are you talking about like some like what you should not do? Is that kind of what you're saying?
Kind of. Yep. Yep.
Okay.
Yep. Right. 1 second. I'm just responding to a student here. Negatively framed question could be, you're educating parents on the dangers of smoking in the house when a kid has asthma. What does the parent say that would indicate they need further teaching? So, what does the parent say that's wrong or that's incorrect that you need to correct them on? The nurse is mentoring a new nurse, a new graduate. She is going through. She is going. I'm sorry. Can somebody mute, please? Can somebody mute with the background noise, please? Thanks. The nurse is mentoring a new student, a student nurse. She is doing discharge instructions with a patient going home after a stroke. What does the new nurse say to the patient that leads you to believe that the nurse needs more re-education? Right? So what did she say that maybe is a little bit off, or she didn't really say it in the right way, or she could tell the patient needed more clarification? That's a negatively framed question. What is somebody doing that it's either wrong, needs to be corrected? You are reviewing with a parent. You are reviewing with a parent whose family has a high risk of obesity, and you are talking to the parent about healthy practices. What does the parent say? I'm going to do this, that they didn't hear what you said. It's a wrong answer. You have to correct them. Does that make sense? Those are negatively framed questions. So watch for those. Okay. Levels of prevention, healthy people, objectives. You need to review those. Okay. We'll talk about those in a minute. We need to understand the difference between community-based, community-oriented. We'll review that in a minute. Review concepts from the study guide. Critically apply each concept to a type of question that you could be asked to answer. So that's the knowledge to practice, knowledge to application. Of course, this is not an inclusive study guide. Okay. This is part of your preparation. It also includes your readings, your lecture. If you missed any lectures or missed any parts of lectures, I suggest you go back and review the part of the lecture you didn't catch or you missed. Review the recordings we send you. That's good prep. This guide is good prep. Okay, so I put a couple little bullet points in each of these. I mean, hopefully your study guide is already completed. Not completed, but you've already started filling it out. Right? But here's a couple of things. Okay. We need to know the difference between community-oriented and community-based nursing. What is it? You guys tell me.
Community-based is actually within the community, like a school nurse.
You're based in the community. Yep. What are some other examples, Holly, of community-based nursing?
Like a nurse like we were talking about just a little bit ago at the homeless shelters, they would be based within the community. The school nurses who are traveling nurses, they're within the community doing outreach care in home.
Yep. So community-oriented means you are orienting yourself to the entire community, the whole population. Okay? Community-based, you're based in the community. Could be a school nurse, hospice nurse, dialysis nurse, immunization nurse, occupational health nurse, epidemiology nurse at the public health department, public health nurse. You are based in the community working with illness care. So it's a difference between looking at what are the needs of a population, community-based nursing, community-oriented nursing. versus what are the needs in the community. And school nurse is a great example of a community-based nurse. I was a school nurse for 20-something years. I was based in the school system. Our model, we covered lots of different schools, all right? But we were based in schools, okay? One of the things I would like you to review is your community-based nursing and you're working with families of immunocompromised kids. What kinds of things are you going to teach the parents? Or teach the teachers? Or teach the administrators?
How to
because
use, how to
Go
take
ahead.
the medication.
Yep.
Maybe if they have asthma, how to use the inhaler.
Okay.
What the triggers are for asthma attacks and how to avoid them as best as possible,
Okay.
and what to do if they happen.
Yep. What kind of kids are considered immunocompromised?
Children with leukemia.
Kids with
Cancer.
cancer that might be in treatment. What else? Kids with blood disorders. Other kinds of blood disorders. Kids with what? What else could they be immunocompromised with? What about teaching good hand washing? Right? Teaching good hand washing to the teachers, to the para staff that's working with immunocompromised kids in the schools. What about if immunocompromised kids come to the clinic, the health department clinic for whatever, immunizations? What kinds of things do we need to think about to protect the immunocompromised kids? Where there's an outbreak of pertussis in the schools? Where there's an outbreak of chickenpox in the preschools?
Like what kind of precautions everybody
Yeah.
would need to be on.
Yeah. Care of the immunocompromised kid. So think about that in a clinical setting. What would you be doing in the hospital, in an emergency room, if you had an immunocompromised kid? What would you be doing at home? What would you be doing in the classroom? What kinds of kids are considered immunocompromised? How do you teach parents good hygiene skills? How do you teach teachers good hygiene skills? What do you do? What does the health department teach the school nurses to do if there's an outbreak of an infectious or communicable disease with immunocompromised kids? Okay. What are risk factors? What are risk factors and how do they impact disease? What kinds of risk factors might clients have in the community that might impact disease? Do they live in poverty? Are they homeless? Do they live in a community that's crime ridden? A lot of gang activity, a lot of violence? Think of all the risk factors in communities. Old housing, new housing. High unemployment rate, low unemployment rate. High graduation rate, low graduation rate, a lot of dropouts. So let's think about risk factors and how they impact disease. Let's say you live in poverty and you don't have a lot of nutritional choices. Maybe you're more at risk for getting obese, right? Let's say you live in a rural community and there's not a lot of access unless you go to the closest town to get immunizations. And the kids you have a higher rate of not being immunized. That's going to impact preventable diseases potentially, right? So think big picture. What are risk factors in a community and how they impact disease? Think of the elderly. The risks, all the risk factors that come along with simply being elderly. And how they impact chronic disease or diseases. Okay, levels of prevention. There are several primary, secondary, tertiary level questions on each exam and in the HESI. So let's have a good understanding of them. What's primary?
Prevention.
What's secondary? Okay, expand on that. Prevention of what? Anything?
Diseases, illnesses.
Might be health education for high school kids on safe sex. The risks of substance abuse. Maybe with the adolescents, talking about seatbelt safety when they get their license. Younger kids, helmet safety when they start riding a bike. Doesn't have to be just disease focused. Okay? Any kind of prevention. All right, so secondary, what's secondary?
Screening.
Okay, what are you screening for?
Breast cancer.
Okay, what else?
Infection.
Infection? What else? Screening for risk, right? Basically screening for risk for anything. Are you at risk for injury? Are you at risk for disease? Are you at risk for diabetes? Are you at risk for behavioral issues at school? At risk for autism? What are you at risk for? That's what it's all about. Early identification and early intervention. You're screening for risk. It doesn't have to be just disease focused. In schools, we screen for kids with behavior issues. How do we screen? What's their home life like? How are they acting in their classroom? What's going on in their personal life? Are they being abused, neglected? We have to screen for behavior. We screen for academic progress. So it's not just disease focused. We're screening for any kind of risk, right? And then hopefully, if we identify risk, whether it's high blood pressure for the elderly at a screening at a health fair, whether it's a kid gets in trouble at school and we start screening about why they did what they did, and as it turns out, there's lots of issues going on. Abuse at home, substance abuse with parents, right? Hopefully, when we identify risk, we can early intervene. That's the goal. That's the goal with secondary. Once you have identified your screen for risk, let's say you've identified for risk, you can then intervene and try and reverse that course, whatever it is, because you don't want to let it get to tertiary. Okay? You try to reverse the course to have them manage that. Well, I don't want to use the word manage because I use it in tertiary. What's tertiary?
They already have a disease. Like
Or an injury.
diabetes,
Yes.
an injury.
Disease, condition, injury, illness. Let's say a kid broke his leg skiing over the weekend. Right? What are we going to do in the school setting to keep this kid safe? That's tertiary. He's had an accident. Well, we got to make sure that the restrictions, that the discharge papers the parents brought in have restrictions, right? So no participating in PE or recess. We have to do that, right? It's so we're managing something. We're maybe managing somebody who's had open heart surgery that's going home, managing somebody who's had a stroke, managing a kid who got in a car accident and has a TBI, concussion protocol. They have to have something. That's the key with tertiary. Okay. Education happens at every level, right? We all know that at this point from me lecturing, right? Education at the don't be tripped up with education only happens at the primary level. We educate to prevent. Sure, we educate to prevent health fairs, health screenings, health education classes. I did a lot of primary prevention with kids in schools. Try to prevent something. But we also educate at the secondary level. Let's say we find they're at risk for something and they are at risk for something. Then we try and educate them about, hey, you're really at risk for high blood pressure when you get older. Here's some of the things you can do to reverse that. All right, so you're trying to educate to reverse that risk course. And then tertiary, you're educating, something has happened. Maybe they have a TBI, you're educating about how to manage that, how to help them regain the quality of life they had. All right, so you're educating to treat and manage. Okay, we all clear about primary, secondary, tertiary?
Yeah, thank you for breaking it down like that. It's very helpful to memorize it the way that you put it. So thank you.
Awesome. Okay, Healthy People 2030. Okay, review how you do a home safety evaluation, specifically when there's a firearm in the house. Let's say you go do a home safety evaluation. And the first question you ask is, and this is standard, this is actually what happens. Do you have a firearm in the house? And the answer is yes. What do you want to know about the firearm?
Where is it
What-
located? How is it kept?
Where is it located? Is it secure? Do the
Who
kids
has
know where it
access to
is?
it?
Go ahead.
Who has access to it? Does the kid have
Who has
access to it?
access to it? Is it stored properly? Is it unloaded? Is it ammunition stored or whatever? Is it stored in separate places? Is the gun stored separately? Right? But that's one of that's the most important initial part of that safety evaluation. And that's a Healthy People 2020 goal. Right? Safety. Home environment safety. How may race and ethnicity affect health status and health outcomes? Let's talk about that for a minute. Go ahead.
Different race or different ethnicities are prone to certain diseases just because of who they are.
Okay, genetics,
Right.
right? So we talked about this in class, right? Certain risks with certain races, certain ethnicities. Remember we talked about genetic, environmental, and behavioral. Those are all different risks, right? So think about genetic, maybe like Tacola said, maybe you're predisposed to something because of your ethnicity or your family history. Maybe you're predisposed to cancer. Maybe you're predisposed to alcoholism. Maybe you're predisposed to developmental delays, but something genetic makes you predisposed. And that could be race related, ethnicity related. And then remember environmental risks, how that, let's say you live in a community that has a large non-English speaking population. Lots of different races, lots of different ethnicities located in that community. Think about all the potential barriers, right? Low literacy, afraid to go and seek out help because how are you going to communicate what's going on? How are you going to understand what they tell you? How are you going to understand the treatment plan? Right? So it could be a language barrier.
I
Go ahead.
apologize. I didn't mean to interrupt you. But could that also be for I know like in the news there was a recent thing about women of color who were finding it very difficult to get proper maternal care.
Mhm.
Like during pregnancy, they just because they were Black women or they were Indian women or Asian women, and there
Sure.
was such disparity and vulnerability to having like just a more like a poorer health care
Exactly.
setting and type of management.
That's
because of
exactly
their
what
color.
this bullet means. Define how race, ethnicity can affect your health status. It can. Right? It certainly can. So maybe Holly, I don't know where this story was based out of. Maybe this was a community that had not great access to OB care.
This has been like on the national news a lot, and it started from the first time that I saw it was in the Carolinas,
Mhm.
actually towards Raleigh, And there was a lot of disparity in the community, and people had seen it, that there was more of a higher rate of fetal death in Black women and maternal death in Black women than there was to their white counterparts, just because their level of care was so mismanaged and different. And it was a very interesting news to listen to and hear about, and it's continually growing, and it just keeps getting more widespread as it
And-
goes.
That's what we call disparities, health disparities.
Yes, ma'am.
So there's a perfect example of how maybe gender, race, ethnicity, all can affect your health status and outcomes for many different reasons. That's why I was talking about you have your genetic risks, your environmental risks, which I think Holly's example is more of an environmental risk. What is going on in that environment that this particular group of people cannot get adequate healthcare? And then you have your behavioral risks. You remember your behavioral risks. They're all about choices, personal choices. You choose to be obese, right? You eat healthy, unhealthy. So maybe you're obese because of that. Maybe you have liver disease because you've chose to drink excessively. But that's what a behavioral risk is. It's all about your personal choices. All right. So we can define risk from risk of health outcomes, health status based on genetic, environmental, and behavioral. Okay. Introduction to vulnerability. We all know at this point what groups are considered vulnerable populations. Start listing them. I'll start because I'm a veteran. I'll start. Veterans. Who else?
Migrant
Homeless.
workers,
Homeless, migrants,
Children,
children,
mental health,
mental health,
pregnant adolescents.
pregnant
Pregnant.
adolescents.
Farm workers.
Yep. Farm worker, elderly.
Mm-hmm.
And just so you know, and I mentioned this in class today, children will have the highest risk of poor health outcomes due to risk. So let's say kids are living in poverty, kids are living in homeless. Kids are most, could somebody please mute that has children in the background, please, just for the sake of everybody else. Children have the most adverse outcomes associated with risk. Then the other blanket statement I will make is financial stability. Financial stability of an individual, family, or family is the single most important factor when it comes to health outcomes. Right? Think about it. Think about if you are not financially stable, think of all the risks associated with that. Education risk, healthcare risk, nutrition risk. Access, I already said healthcare. Affects everything. The financial stability of a family has the greatest impact because so many areas are impacted. Right? Okay, what are the risks of vulnerable populations? We've kind of already covered this, but go ahead. What are the risks?
a greater risk for long-term chronic illness,
Perfect. What else?
Greater risk for infections.
Greater risk for lack of access to healthcare / quality care. Less access to maybe quality education. What if you live in a community that has a high school dropout rate of 60%? We have numerous vulnerable populations in all of our communities. Just think about it. Think about driving down the street. Think about all the risks for a homeless person, a homeless family. Think about all the risks of all the families in your community that live in poverty. I mean, I think back of my years in the schools and all these kids at risk for whatever reason. How does poverty potentially affect pregnancy? Let's say you're working with pregnant teens or pregnancy in general. How might poverty, how is that going to maybe affect pregnancy?
Malnutrition.
No access to prenatals.
Yep.
Prenatal.
There you go. No access to
Lack
prenatal.
of-
Go ahead.
And lack of like education and stuff.
I want to go back to introduction to vulnerability. Let's say you're working with the homeless population or a very vulnerable population, and you have been assigned to work with them. How do you initially approach these people, initially engage with them? What's important?
Establishing trust and
Respect.
rapport.
Establish a good rapport.
Exactly. These people don't want it. Most of these people don't want to be in vulnerable situations, right? If you can establish a open, trusting relationship from the onset, you will be able to figure out what resources they need. But it's all about one of the things about vulnerability, and we talk about this in my cultural competence part of the term, but I'll mention this now. We as nurses have to check our own feelings, right? We need to check our own feelings. Let's take homelessness for a second. When you're driving around your community and you see a homeless encampment, you don't have to answer this out loud, but what do you think? Do you think, oh, well, why are these people like here? You have to be able to check your own feelings, your prejudices, if any, biases, past feelings about these populations. It's hard to work with, or I think of the LGBT community. You have to be able to appropriately work with these populations in a non-judgmental, compassionate, caring manner, which means you have to assess your own. You got to do your own self-check-in. That's part of that initial, that's really kind of the first thing. You got to really figure out where you're at before you can start to establish that trusting relationship with all these vulnerable populations, right? Okay, school nurse. What does a school nurse do? What do we do?
Provide safety and education.
Safety and education. What else do we do?
Care.
Provide care, medications, pre-treating with your inhaler before gym. So we're direct caregivers, right? We're health educators. We do screenings. We do vision hearing screenings to find eye issues, if any, starting in preschool. We do hearing screenings to see if we can identify any hearing issues early on. Maybe we do scoliosis screenings. BMI for maybe potentially, let's say we identify a group at risk that might be at risk for obesity. Maybe we do additional screening. We do direct care, right? Giving medications, cathing students. I was doing trach care, seizure medications, taking care of diabetics with their pumps and their pens. That's direct care. We're always consulting with doctors, the impacted kids with complex chronic issues, right? We get orders from the doctors to do this at school. They're your consultants. You're talking back and forth with doctors. How do you want us to do this? Or, your directions weren't specific enough. So we're consultants. We're health educators. We're community outreach. We work in the communities. We do health fairs. We do vaccination clinics. We may even have a health clinic within the school. So I worked in a big district in Denver. Several of our high schools had clinics, like healthcare clinics for that were staffed by nurse practitioners. So they could go, parents could come in, not just, it was all the parents in the community, not just the high school kids. It was just located in the high school. They can come in and get their immunizations. They can come in for a well child check. All part of school nursing. And remember, we talked about this. We do not diagnose. We don't treat. That was one of our quiz questions this week. Okay, nurses do not diagnose. They do not treat. Okay, so my example today used was conjunctivitis. It was one of the quiz questions. So if a kid came to the clinic, their eyes were all junky and they're itching, watering, whatever, I would call the parent, say, hey, here's what's going on with your kid. Or if they had a rash, here's what's going on with your kid. I really, you know what, you need to come pick him or him up, her or him up, and take them and get checked out. We got to figure out what this rash is. Got to make sure it's not contagious or whatever. And same with the eyes. Well, the parent would say, well, do you think it's conjunctivitis? Well, you know what? Kind of looks like it, but you need to, that's between you and your physician. So we don't diagnose, we don't treat. We'll follow a treatment plan once it comes back to school, but we don't, like, we wouldn't diagnose and say, oh, you have conjunctivitis. I've got some eye drops up in the cabinet. We'll start those. All right. We don't do that. Okay. Growth and development. What are the most common risks? So I want you to know, what are the most common risks for each age group? Like for example, you can go back and look at this up in your reading in your growth and development. I think it's chapter 11. Like younger kids, head injuries from bikes, adolescents. I'm thinking going off memory here. Head injuries from car accidents or car. So just know what the most common risks are for each age group. Teaching families about obesity prevention. Big issue in this country, obesity. So a lot of our teaching in the schools goes towards obesity. What should be included? Healthy diet, healthy exercise. Is the family modeling good behavior and good decisions? So what do we want to teach families? Common childhood ailments. There's a lot of questions about common childhood ailments in this exam. A lot. Okay, so go back and review if you don't have a good handle on these. What I really want you to know is, what is the ailment? This was your discussion question, so you're already way ahead with the 3 that you chose. But go back into your discussion question, the big thread, and read about the other ones that you didn't choose from your peers. You got to have a good understanding. Okay, what's lead poisoning? I'm up here. What's lead poisoning? What do we teach the parents about lead poisoning? What do you teach the parents who smoke with a kid with asthma? All right. How do children at different age groups react to a diabetes diagnosis? You know, a little kid maybe doesn't have a clue, and you got to do everything with them. But an older kid maybe want to be independent. They want to check their own blood sugars. Is that okay? Sure. So read back through your diabetes, because they all like as a school nurse, a 4-year-old says, oh, I want to give my own insulin. Well, no, can't comprehend anything. But a 12-year-old or a 10-year-old that's been diagnosed for a little while, that's been practicing on pillows, and they show me how they do it and it looks good. Sure. Okay, so understand how different groups may react to a new diabetes. Well, there's how to help your child who would like to learn to give their insulin injections. Scabies. What do you teach the parents about scabies and lice? Okay, remember, this is clinically focused, meaning I have a parent who called me that said the kid had scabies. So now I have to go into my teaching mode. So at clinical, what would I have to tell the parents so the kid comes back free of scabies? Same with treating lice. What do we have to talk to the parents about? You're in a teaching mode. about how to stop the spread of lice or how to get rid of it. Same with ADHD. How do we talk to the teachers? A lot of the common childhood ailments come from the school nursing area. What do we talk to the teachers about with ADHD? You know, should we put them in the front of the classroom so maybe they focus better? It's not punitive, but maybe put them up there, they focus better. Maybe give them more breaks. Maybe don't punish them if they act out and take away recess because they need that activity, right? What else do we do with ADHD? Maybe they need reminders to go to the clinic and take medication. So again, think clinically focused. I don't mean clinical in a hospital. They're coming to the health room at the school. And they actually have scabies, they actually have lice, they have ADHD. How are you going to treat them? One of the things, if they have lice, you're going to have to talk to the parents, right? So you're going to be teaching with the parents. What's iron deficiency anemia? What happens if it's untreated? Let's say a parent says, no, I don't want to do what the doctor said, it's left untreated. That can get pretty serious. So I want you to review that. This is all in your readings. What kids with eczema? Eczema is caused for a gazillion reasons, allergies, asthma, food, whatever, right? What do we teach? And again, like I said, if you go back and review, there were over 60 posts in all my classes, meaning that the thread of your discussion that was common childhood ailments. There probably every single thing in here, every common childhood ailment you need to know about, a student did on their 3 common childhood ailments. So yeah, go back and review the little snippets, you know, in your reading. I think from week 2, it had little snippets from your intro to peds and maternity book. Don't read the whole chapter, just go back and read those snippets of pages, right? But go through your discussion board. Students did a fabulous job. Okay. Can remember, it was a teaching plan. Everybody had to do teaching plans with parents. So these are what the exam questions are focused on with these common childhood ailments. Not only what it is, you should know what it is. How are you going to resolve it? Is it going to require teaching with parents, teaching with teaching teachers? Again, clinically focused. Eczema, conjunctivitis is on the exam. Again, go find if you didn't do conjunctivitis as one of your 3 common childhood ailments, go find a student who did. Because what did you have to do? What is it? And what would you teach parents? So that's an excellent resource, that discussion post. And then iron injuries. What would you do? What would you not do? With an eye injury, would you really try and rub it out? Let's say they had something in their eye. Would you try and rub it out? Would you try and put their head under a water fountain and, you know, hey, let me run this down and see if it comes out? No. You call the parents, right? They have to be medically seen. You can't be pulling stuff out of an eye, right? You're going to make it worse. And again, that's diagnosing. You're doing something. You're doing an intervention that you shouldn't be doing. Okay? Family. We already talked about the firearms. Think about a home. What other things would you do? What would you do in a home safety evaluation besides firearms?
Do they have fire extinguishers?
Fire extinguishers, good one.
Maybe proper locks on the house.
Proper locks.
They live in an apartment or in a building with lead paint.
Lead paint, perfect. What about the elderly? Let's say you went in and did a home evaluation, safety evaluation for the elderly. What are you going to look for?
Anything that could make them fall.
Are
Carpet
the
on the
rugs?
steps.
Are the rugs
Yeah.
slippery? Is their refrigerator working?
Do they have
They have
smoke
rails.
Do they have skid rails? Is there furniture all over the place that they're going to trip and fall? Right? Okay, week 3. Migrants. What do we want to know about the migrants, right? What's important? What do we know? We need to review considerations for care with the migrant population. Why are they at risk?
They don't have adequate health care, so a lot of them are vaccinated,
Unvaccinated.
unvaccinated, yes.
Correct. What else? Why else are they at risk?
Language barrier.
Hi, Maria. What?
Hi. Language barrier, I think.
Language barrier?
Mhm.
Transportation issues? Not eligible for
Housing.
government, not eligible for government resources? They'll get care through their migrant outreach clinics, but not available for Medicaid, Medicare, WIC, SNAP. They're not available for that. Less likely to have health insurance. Right? They're not going to travel. Like I used the example today in class. Their kids had a cough for a month. They need to see a pediatrician probably. Are they less, I mean, unless the kid gets sick, real sick, but you know, for a cough, are they going to take a day off from work and drive 45 minutes to the city to see a pediatrician? No, they're not going to get paid for the day, right? And they're portable. They're mobile. They're always moving to different places. Hard to keep track of them. Review acute and chronic exposure to pesticides. Acute. What are acute symptoms of pesticide exposure?
Coughing, difficulty breathing, and the rash.
Yep.
Headache, fatigue.
Headaches, confusion, GI stuff, nausea, vomiting, diarrhea, right?
Mhm.
What about chronic? What are some chronic symptoms? What does chronic mean?
Long term.
Long term, they've been exposed to pesticides over a period of time. So yes, acute, you get all your acute symptoms, but what's some chronic symptoms? You've been exposed over a long time.
Cardiovascular
Mhm.
issues.
Maybe respiratory issues, long-term respiratory issues, maybe cancer.
Cancer.
Maybe for females is reproductive issues, maybe infertility, or I mean, just think about it, being chronically exposed to a toxic chemical. So you gotta know the difference between chronic and acute. It's pretty stark. How do migrants see their health? Right here, they perceive their overall health is less favorable. Right? If there's no issue, don't rock the boat. Right? They're not going to drive 100 miles away to go get a checkup. They feel fine. They don't need a colonoscopy screening. They're fine. They just don't have that motivation. They don't really, unless there's something wrong. Okay, review potential causes of GI outbreak in migrant populations. What are they at risk for? Maybe hepatitis, TB. Let's say all these people start showing up at the migrant outreach clinic with GI issues. What are you going to do? Maybe you look at pesticide exposures, go back and talk to the farm owners.
Or even
What are
like
they-
the bacteria like E. coli, they could have an
Exactly.
outbreak of that too.
Yeah. Are there not places for them to wash their hands after they come off the farm? I don't know.
No.
Why is there a GI? Are they living? Remember that we talked about this. Remember, are they living in close quarters with lots of families? Is there poor sanitation in these
No
living
bathroom.
facilities? Gotta check it out. Is there a potential TB outbreak? I don't know. That's your job to figure out. What do we know? Let's see, lack of sources for information about the resources available. We know that. Lack of transportation, we talked about that. Don't have health insurance, talked about that. Language barriers, not available for government resources. Observations, what are we going to see? broken families, fractured systems. This is the migrants and the rural. Okay. Rural this should be down the rural. Rural populations. I'll change that in a minute. Rural populations like to do stuff on their own. They don't like any outsiders. I live in a rural population, way up in Wisconsin. Nobody likes outsiders. Everybody, it's just a very tight-knit community, right? But there's a lot of risks. There's a lot of fractured families, a lot of single families, a lot of young families. They use whatever they have for support. So, like the local Walmart, the local grocery store that's looks like a one room place has a table where they go and have coffee together, right? It's not these big, they just find a way to support each other, right? So they might use churches or places of worship or little tables in a little grocery store, a little bodega where they meet. Very high risk populations, right? In migrant and rural, right? So you have agricultural, you have mining, what else do you have? Lumberjacks, forestry, right? So high risk occupations increase the risk. Accidents from machinery, from tools, right? I'm just looking out the window here because I live on a lake, and there is a humongous tree just floating down the lake. We have winds up here today like 20 miles an hour. There's just like a huge tree. I was just caught off guard with that. High risk occupations come with injuries, come with risk, come with chronic illnesses. Relationships are informal. Everybody up here knows everybody. They're informal. Nothing's formal. Nobody dresses up to do anything. In fact, it looks like everybody walks around in their pajamas around here. Right? They don't really like a whole lot of new people. It's fine to come, like I said in class, it's fine to come up for the weekend and use your lake or whatever and then go home. They like their little communities. And they're very resourceful. Rural, again, what might you observe? We've talked about that. Fractured families. Review what to consider when planning programs to address their needs. You'd like to focus on primary, and you really need to try in the rural communities, but it's hard. Maybe you shift your focus to secondary, right? Okay, we're not gonna, maybe you just need to talk about the importance of screening. One thing when you're working with people who don't prioritize their health care, let's say they're diagnosed with hypertension. They say, oh, I'm fine. They put me on medication. I'll be fine. They really have to understand the seriousness of what they've been diagnosed with. And if they don't follow through with the treatment for anything, cardiac disease, hypertension, stroke, following up with physical therapy, whatever, right? Of what the long-term consequences are. It takes a lot. It takes a lot of communication, a lot of education. The importance of establishing trust. We talked about this, why it's important. Why is the care of this population, we're in homeless now, so expensive? We talked about this today in class. Where do they seek their care?
Emergency room.
Emergency rooms. Homeless population is not going to your local clinic for a primary care visit. They're not. They're not going to the homeless women are not going to the local radiology clinic for a mammogram. They're not. You're going to see them in the ED when there's something going on. Right? Poverty, review, assessing needs of this population. Know that poverty is the greatest, I've already said this, greatest impact on the health of kids. What age groups are most likely to experience a high incidence of poverty? Number one is kids. Number two, right behind them is the elderly. And number three, everything in between. But kids are at the highest incidence of poverty. They say in the rural population, 20%, what did I read? 20% of the population in any rural community lives in poverty. And that translates into 40% of the kids living in poverty. That's a lot. That's not every rural community, but that's kind of an average. What might a kid experience in schools related to living in poverty? What might you see in schools? Maybe behavior issues, fighting,
Social withdrawal and hunger,
withdrawal,
like the food insecurity.
food insecurity, maybe some depression, some anxiety, maybe the older kids, some, or not so much older, but the suicidal ideations, right? So that's what I got. Helpful?
Yes,
Sure.
very much. Thank you.
Yeah, you're very welcome. And we got a whole hour in. That's great. I'm tired since I just finished class. So I'm sure if I'm tired, I'm sure you guys are tired of listening to me. But you know,
It's 7 o'clock.
again, I'll do whatever I can to help you guys get through the term, whatever I can. Obviously, I can't give out exam answers and all that, but if you have a good understanding of the concepts and you are going to do fine on the exam, fine. Please do
Are
not
we-
worry.
I'm sorry, I had a question.
Yep.
Were we able to receive that? We do
No.
have that concept in oh, we can't.
You have it, but it's blank.
Right.
So you
Well,
have
where
to
did you
take
find it at? Because I don't see it. I was
Yeah.
looking for that to print it
You go
out.
print
Week
it
one.
out.
week
It's
one.
like in week 1.
Week one.
Okay, week one. Okay.
I always try and send it out the week like this weekend. You're going to get your week 4 announcement and you're going to get the exam 2 study guide because it's 4, 5, and 6. So I know one of my students mentioned earlier, our other professors give us study guides that have a lot of info. We just, you know what? I've done it both ways. And actually, to be honest with you, I've done it both ways with all the information versus blank and you building your own study guide. And honestly, it's starting to, the last 2 terms, it's reversed, meaning the students that are doing all the work, building your own study guides, taking notes, are actually overall are performing better. So I get it. It's done differently in every class. But we've shifted to a different mindset the last couple of terms, and the outcomes from last term and the term before are better when the student's doing all the work. Not that I'm not doing work. I'm working a lot. But this is, it really is, there is really a shift. Really a shift. So if you are preparing adequately for the exam, you will ace the exam.
Will this recording be, because I missed the beginning, will this recording be uploaded?
Of course it will be.
Okay, thank you.
Yeah. You'll have this whole an hour review. So
Yeah, I miss a lot.
yeah, Maria, come on.
Yeah, because I thought that you said 7 o'clock.
No, 6 o'clock. It says 6 o'clock
Oh.
in your, anyway. All right. So are we all good to go? Does anybody have any questions? Again, the fact that you're here says a lot. So, and I appreciate it.
I like the
appreciate
fact
it.
that you
Okay.
gave out the first before you went into the study guide, that paper that basically is like an outline.
Yeah.
That was
Eh,
very helpful.
Yeah, I'll send that along with my next two exams. You know what, I wasn't gonna resend it out because I don't want everybody to get confused on what's she talking about. That's why I went through it, but it's just the outline of the exam. Okay, and so
Yeah,
if you
I
watch the
get it.
recording, you'll see it.
I get it.
But I'll
Thank
do it
you.
for the next two exams. Yeah, I should have done that for
That's
the
very
first.
helpful.
Yeah, you're welcome.
Thank
You're
you.
welcome. Again, the goal is to get everybody across the finish line. But the fact that you're here tells me that you're all going to do marvelous on the exam. So I hope everybody has a good weekend. Okay.
Thank you.
And
Bye.
then
Thank you.
reach out to your instructors if you get stuck on some concepts after you've prepared for the exam. If you're still unsure about certain concepts, reach out to your instructors and give them a little bit of heads up and set up a quick Zoom meeting and review whatever you still don't understand. Okay?
Thank you.
Bye, everybody.
Thank
Have a good
you.
weekend. Okay.
You too.
Bye.